we have Dr. Priti Nanda Sibil, who's going to talk. After fasting, you must know about gut healing, right? Yes? So how to heal your gut, how to improve your, metabolic disorders is the main important. So how do I explain Dr. Priti? She is full of energy. President of Indian Functional Nutritional Association, Functional Medicine Association. I'm sorry, I always goof up in that. When I first met her, I thought she's into laughter challenge. And she makes you laugh from the core. So please be, along with gut healing, you can have laughter challenge with mind healing too. So, let's hear from Dr. Priti. And your time is here.
Thank you.
Mic, you want the mic?
Yeah.
You want collar mic?
No, I want that. Okay. Good afternoon, everybody. And thank you for a very, very nice talk on fasting. I have never been able to do fasting myself. But despite that, I think I love the concept of fasting. And after fasting, my talk is going to make much more sense. But before I start gut healing, since morning actually, so ozone, of course, works on the gut big, big, big time, right? But since morning, we've been talking about gut-brain axis. Thank you, Dr. Renu, for a very, very nice session, right? And then we had some real amazing cases from Dr. Ramle. Thank you for sharing that. And then fasting. So, what I am going to do is connect all these dots. What is it that we do in functional medicine? We'll talk about that. So, this is my little brief about what I've done. 1989, entered medical college because I was not, of the right age to do my IIT exams. And I thought, chalo, papa khush ho jayenge, medical ka paper to clear hona nahi hai. I'm not going to clear that. And next year I will appear for IIT and become an engineer. But that did not happen. But I am a very, very, very committed soul. So after doing my medicine, 7 years into practice, I again thought, medicine I don't want to do. And I did my MBA from IIM Lucknow and came into hospital management. I headed publishing in Springer. Published about 60 journals, was instrumental in getting medical content on PubMed for the first time from India. Followed it up for 4 years. Was medical advisor at Cipla, launched 50 products in 2 years, right? Headed VLCC Pan India. And then as destiny is very, very important, I think. And I'm sure all of you believe in destiny. And that's the reason I think we all are here. I always, while working, used to think that when my sons will go to hostel, I am going to enjoy my so-called high-flying job. Because once a month I was in US, right? Every week I used to fly morning, evening, and I used to come back late night to my place because my kids were young and I was in a nuclear family. So एक दिल की ख्वाहिश थी कि बच्चे hostel जाएंगे तो मैं भी 5 stars में enjoy किया करूँगी, घूमूंगी with every travel and I will have fun. But as I said, destiny. When my youngest son went to NLU Jodhpur, I was 89 kgs, diabetic, fibroids, cervical, fibromyalgia, 3 days in a week with migraine, with that band on my head, and asthmatic, allergic rhinitis. In the morning, I couldn't get up till I did about 30, 50 sneezes, right? And that was me, and I will show you my picture. And I was traveling, I was in US, and one of my friends said, why don't you work on your health first? I came to know about A4M, and corporate may one thing is there, we want to do things in big. So I enrolled for the full 8 modules without knowing how much I will have to study coming back from MBA to here. And then 7 years, I'm now into functional medicine. And I'm also a certified executive coach after MBA. Before I came into functional medicine, I was helping doctors increase their practice by 10-fold, 50-fold, 100-fold. I am a P&L person. I love numbers. I love Excels. Nothing without numbers makes sense to me, right? So I am now going to talk about gut healing through functional medicine approach. So 28 years of experience from Amritsar Medical College. I am Lucknow, Fellowship in Functional Medicine, the President of Indian Association of Functional Medicine. And I want all of you to note this number here, Renuka's number, 98180-90200. This is Renuka's number from Indian Association of Functional Medicine. Any one of you who wants to be a member of Indian Association of Functional Medicine, the criteria for joining this association is your passion to heal people in a holistic way. Every person has a different cause and therefore a different solution to their problem. And we are wanting through this association to take integrated medicine or future allopathy or conventional medicine is how I call it, to every household. Because I strongly feel that for India to become the economic power, #1 economy in the world, one of the 3 important things which can come in the way and which is coming in the way is health of our people. And it is very, very important right now. We are at a juncture where we are almost there. And if we all in this room can together think, work together, and take this to every household, nothing can stop us from being the #1 in the world. Dr. Praveen, I hope you agree with me. Good morning. So I'm an author of 3 books. Cyclic Keto was the first book I wrote. And because I realized that there were maximum myths around keto, and this is the most wonderful diet if you can do it right. And this can be your, this can lead to health disasters in your life if you don't do this right. And I have till now majorly written for a lay person, so I write the way I speak. So I would recommend that you read it. You will love reading it, I can promise you that. 4-hour rapid fat loss method. Now this book I wrote because I was trying to lose weight and I was unable to, and I am a foodie. I cannot follow a diet plan, sorry. This is not for me. And then I realized that, if you spend 4 hours a week and you know how to balance your hormonal triad, you will never think about how to lose weight and what to eat. Punjabi ghar se hu, do kaam hi aate hain, khaएं kya aur bahar ghataएं kaise? Anyone who knows Punjabi here for them. So what I just said was, what should I eat and how can I lose weight? These are the 2 things the family we come from, we talk about this. So this book is about that. For a lay person, must read. They are available on peakwellness.in and Amazon. And then this is the book I wrote, What Doctors Must Know About Diabetes Reversal, right? And this was because I reversed my diabetes, and for the last 7 years, my insulin and my sugar numbers are always perfect, right? And I have this typical ad which runs on my YouTube channel, मैं अब गुलाब जामुन खा सकती हूँ, right? And I can strongly tell you that, this is possible. Diabetes can be reversed for life. And I come from a family where all my aunts were never less than 120 kgs. In fact, I lost one of my aunts because she was one of those persons, one of the first few people who underwent bariatric surgery in Delhi, and post that she did not survive at a very, very young age, We lost her. And I saw my aunts not able to sit on these chairs, and they were bedridden for last 15, 20 years. And the day my HbA1c rose, it was a shock for me, right? Because I had seen my aunt suffer from the time I was a child. So it was mentally very, 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 very devastating. So this is what I've written. And then what is gut? I strongly, anybody here who believes in God, please raise your hand. Right. And I also believe in God. Then I also believe that gut leads to obesity and diabetes. So the reversal of diabetes and obesity will have to come only by working on your gut health. For me, gut health can be defined as state of well-being and absence of gastrointestinal distress. Is determined by numerous factors, majorly gut microbiota. All naturopathy doctors here, Ayurvedic doctors here would agree with me more than my allopathic friends. But I'm sure if you are here, you would agree with me on this. So when I look at gut health, this is one slide which actually takes majority of my time. Whenever a patient comes to me, the history is so detailed because I want to know whether there is anything in the mouth which is disturbing the digestion, right? It comes from looking at the tongue, at the teeth. How does the person chew the food? How do you use your senses to eat food? So when I came into functional medicine, first thing I did was I did 100 talks in schools for teachers. My mother retired as a teacher, and I always thought teachers can influence people when they're young. And my topic used to be food meditation. Because when you use your 5 senses to eat, there is no better way to meditate. And for people like us, especially me, type A personality, meditation very difficult. But food meditation is something I could do, and amazing benefits. So rather than just think that chewing your food well is important, I would suggest start using your 5 senses. Look at your plate. Count colors on your plate. Every plate, every time you sit and eat, if you don't have 7 colors on your plate, stop and add some more colors on your plate. Smell your food. Feel the texture. And then comes chewing. What have you done during this time? The saliva which is released during this time when you're using 5 senses helps you digest your food better, right? And why is that important? Because I feel that stomach is the CEO of the company, right? Like thyroid is the CEO of your body. Stomach is like the CEO of your company. If you have a bad employee, like your mouth or your senses where you're not using your 5 senses, the workload on the stomach increases, right? And when the workload on the stomach increases, everything after the stomach goes for a toss. Yeah? So using 5 senses is extremely important. If you have a good team, then the boss's job is very easy, right? You just have to go and speak and you are done with it. After that, stomach. Now, stomach is extremely important. There is a reason why we have acid in the stomach. Anybody here who can tell me what is the benefit of having acid in the stomach? Anybody who can stand and tell me 3 most important uses of acid in the stomach? Because I personally feel digestion cannot be right if we do not know this. Most important thing. Yeah. What else? So, right, yeah. But what okay, so, yes, fire. But 3 important functions of this is 1, protein digestion. Overall digestion, yes. But today a lot of patients come to us, and if in fact we think that we don't have enough protein, we don't have good muscle mass, are we eating enough protein? Even on a vegetarian diet, we do eat enough protein if our digestive system is able to absorb it. And for that, acid is extremely important. Second, we see a lot of us now getting deficient in magnesium and zinc and other stuff. Absorption of magnesium, zinc, if you have low acid, absorption will go low. Of course, food we are eating has less nutrition today. But on top of that, because most of us have less acid in our stomach, whatever we are getting, we are not even able to make use of that. And third most important function of this acid in the stomach is, this is the place where everything becomes sterile. If your acid is low, chances that you will have infection henceforth from your stomach going forward are much, much higher. There is a reason the pH of our stomach has to be between 1 and 3, right? And then when it comes to digestive health, I've seen 30 plus, very, very difficult that you are making decent enough acid in your stomach. And this betaine HCl, how many of you here use betaine HCl in your practice? Wow. So other than these 3 people, I think this is one product you all must know how to use, and you all must give the benefit of this product to people. Of course, in naturopathy and all, we can use ginger pickles, we can use apple cider vinegar to improve acid, but When the acid really becomes low, a short stint of betaine, Gred Care is the name of the product which I use, is amazing. You can give 14 tablets a day. After taking 1 or 2 bites, you eat these betaine tablets depending on your particular dose. So you take 1 tablet in 1 meal, second tablet in second meal, 2 tablets in second meal, 3 tablets in next day's meal, 4 tablets in your fourth meal, and you can go to the maximum of 7 tablets. Your stomach will start becoming flat without making any effort. Check your poop in the morning. If you see undigested food in your poop, anybody here who checks their poop one every day in the morning? Please raise your hand. Yes. Do you see any undigested food if you have had beans, if you have had nuts, if you have seeds? Any undigested food, if it is there, you are low on betaine. Please sort this out. I have had patients, in fact, I think I will share a case study if time permits. Many people who've been on PPIs for last 13 years, 20 years, 23 years. In a 3 months' time, they've been able to come off PPIs completely by use of betaine. In fact, today there is data to suggest that actually high acid, not more than 20-25% people have. That also I'm exacerbating. Most of us today who have acidity or symptoms of indigestion, we are all going through low stomach acid. Anybody who can tell me why is it so? One biggest reason why most of us have low acid today. Okay, no. Something even bigger than this. Today, आज के environment की बात है. No. No. The big elephant in the room, we all know it. No. Yes, stress. Can we clap for her, please? Dr. Shikha, stress. What happens during stress? Food is the function of which system? Parasympathetic system. What happens when you are stressed? Your sympathetic system gets activated. What happens then? All the energy which is needed to digest food, we have diverted it. We think we are smart. हमने तो किसी को चकमा दे दिया. खुद की बैंड बज गई. We don't know that. Exactly. Few other things which we are not doing, right? For example, I don't know how many of you noted, I generally eat from my hands now. I don't use spoons. Why? Because this energy. What happens is, this is one sense out of the 5 senses. And I have to use that so that I stimulate my parasympathetic. I get the prana in the food. I secrete more acid. I digest my food better. Second, in our traditional days, you would see we never had these dining tables. Right? Why? Anybody who can tell me why? Gut is a very interesting topic. I was telling Dr. Millie, I will leave all of you today in a state that next time when Dr. Millie does her workshop, she will have to organize half a day or full day training from me on gut. Where is Dr. Millie?
When we sit and eat on the floor, we stimulate our parasympathetic.
Exactly. Also, all the blood supply, everything, the focus is here. When we sit with our legs hanging like this also has to be supported. And digestion is a very, very, very high energy consuming process. This is what makes you from that small child, जिसका हाथ गर्दन के यहाँ तक नहीं आता, to these handsome and sexy, men and women. What has changed us from that small child to this? Not food, digestion of food. So digestion is extremely important, and rather than starting from the other end, start from here. If you have set acid in your stomach right, then only move forward. Otherwise, whatever you are doing is a waste. And other than the 3 people here, if you don't order Gred Care and use it for yourself and your patients, I think this is not done. Right? Please do that. So, of course, after I've done the stomach, yeah. GREDCARE. And I'll also tell you the number and the company name where we can get it. So, Another thing which I am seeing in my practice, see, patients come to me when they've been to almost 10, 15 doctors. And a lot of people here would know why that is the reason, right? So I will not share the reason, but I do not get a patient, you know, somebody comes to know, oh, I'm trying to heal myself and Dr. Priti does functional medicine, let me go to her. No, 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 no. Nobody will come to me like that. I have made sure that that does not happen. Right? H. pylori. Repeated cases of H. pylori, undiagnosed cases of H. pylori. Very, very common. In fact, few days back I was telling somebody, maybe I'm going to become H. pylori specialist if this is how it starts moving. So, we did not have a H. pylori herbal product in the market. So, we have launched it now by the name of H. pylori Care, which is a combination of berberine, bismuth and mastic gum. Because otherwise I had to give all these three separately and that becomes very difficult. Along with that, sauerkraut works wonderfully. If by chance you have a patient where, you know, the patient says that I had H. pylori a few years back and since then my symptoms have come back again and I'm not feeling well, that patient would have SIBO, SIFO or a recurrent H. pylori. Check what is the infections. But sauerkraut, zinc carnosine for 6 months post H. pylori infection helps us prevent relapses of H. pylori. So, and that's simple. Zinc carnosine, sauerkraut and Gred Care to improve the acid because we know that H. pylori's main work is initially it will increase the acid and later on it will make sure that the acid is less so that the environment is conducive for its growth, right? So post that, then of course I look at the enzymes, I look at the bile. A lot of times you will see that patient's history is extremely important. Patients will say, whenever I have fat, I feel bad, right? I feel pukish, yeah? They will say that my motion is very slimy. Of course there is infection, but high chance bile is also not being produced properly because bile has a huge, huge, huge role in our body. Even if cholecystectomy has been done and the patient does not have a gallbladder, bile ducts do secrete some bile. And it is important that we have good flow of bile, it doesn't become sluggish. Because if that becomes sluggish, it is going to be very difficult for us to clean our liver. Then next, of course, comes our liver. I never knew liver is so important and I was not focusing on liver so much, but now, till the time my liver gets cleansed, I do not start working on gut infections. Why? I know. Because the moment I start working on gut infections, the load on the liver increases. And the liver gets more choked. You repeat the test after 3 weeks or 1 month. All your liver parameters will be worse than what they were in the beginning. So clean the liver first and then work on gut infections, right? Of course, small intestine, large intestine, rectum. Huge role of probiotics here, huge role of prebiotics here. And one tip, prebiotics, of course, we can buy from the market, but food is the best source of probiotics and prebiotics. If you visit my channel, YouTube channel, Food, Medicine and Lies by Dr. Priti Nanda Sibal, I have made Indian version of almost all probiotics. Videos are there. Please have a look at it. And what I've realized is, simplest thing is, making vegetable pickles and having them. It takes few hours to make it. You can make it every week. You don't need anything from outside, right? And starch, very, very important. So boil your apple and eat it with cinnamon. You don't have to buy modified citrus pectin, which comes at 9,000, 10,000 bucks for a month, right? And it really works well. You can have it at 11, you can have it at 4. It really helps. Boil your potatoes, keep it in the fridge for 24 hours. After that, you can make chaat from it, you can cook it, you can make tikki from it. The carbohydrates in potato get converted into resistant starch if after boiling we keep it in fridge for 24 hours. And beauty is, when you heat it after that, the resistant starch does not get converted into carbohydrates. So anybody here who is a potato lover, you don't have to leave potatoes. You have to just use it in a different way. Yes, please. Okay, so I will, I can go on, but this is where I will leave you at 10% of my presentation. Anybody who has gas, bloating, diarrhea, constipation, abdominal pain, cramping, eczema, dry skin, psoriasis, acne, hormone imbalance, PCOD, tired, fatigued, rundown, weight gain, trouble losing weight or gaining weight, trouble sleeping, stiffness or joint pain, obesity, autoimmune, thyroid diseases, start with your gut. Because if you will start with your gut, it will stay with you for life. And if you do something from outside and the center is not right, it will keep coming back again and again. Thank you very much. I had so much more to share, but no time. And before I go off the stage, I would request all of you to please stand up. Great. And it would not be fair if we don't do laughter yoga after Millie saying this. We are going to do handshakes with each other with a bout of laughter. So I'll show you how it is. Can you please come here?
So please, I'm going to be here because me? Thank you. That was really nice.